Meanwhile, Northern Light Inland Hospital, which is in Waterville, will be closing its doors in just over a month after being open for 80 years.
The announcement came a month ago, shocking the community, leaving many to grapple with the loss of a pillar in the city's health care. News Center Maine's Christian Harsa has more on how the city is looking ahead.
Community leaders in Waterville are preparing for the imminent closure of Northern Lights Inland Hospital.
We run around 5,700 calls a year, making us the 7th busiest department in the state.
Waterville Fire Chief Jason Frost prides himself on his department's 5-minute average response time. However, Inland Hospital is the city's only inpatient center, meaning some calls will take an ambulance to Augusta or Skowhegan, turning it into at least an hour round trip.
What I have asked the council is to put on a third full-time ambulance.
The department already has the 3rd ambulance, but will still need 8 new EMTs to staff it full-time. City Manager Brian Cainreth estimates it will cost $1 million annually and requires city approval.
We're having those conversations right now. We'll see where it goes, but again, we are concerned about providing good service to this community.
Not all Northern Light services in the region are closing. Northern Light Continuing Care's Lakewood location and nearby walk-in care clinic will remain open. Yet over the 2 decades Northern Light has owned Inland Hospital, staff say the facility has cost the care provider $60 million. Senior Vice President Marie Vino says closing the hospital should help preserve other Northern Light locations in more rural areas.
It helps us to redirect resources to those areas that wouldn't have another option for health care.
Still, Inland's closure will leave a void in the city's healthcare, which hospital and city officials say they are collaborating to fill. Waterville still has one emergency room at Maine General's Thayer Center for Health, which, according to a statement, President and CEO Nathan Howell feels will be able to absorb a lot of the emergency room calls. But city officials still expect an adjustment period.
But I think it is a wait and see a little bit these first few months of how it goes.
Regardless, Chief Frost says EMS will still be there.
We will do everything in our power to make sure that they don't see an impact.
Inland Hospital will stop medical services on May 27th and close completely on June 11th. In Waterville, Christian Harsa, News Center, Maine.